get started here in about 9 minutes. We're just going to get it going so everybody can get on, join us. We're going to be making sure that the screen is good. So I'll be checking in, but tell everybody we're going to get started at 6:30. If you are letting people know we're going to do it tonight. We didn't do it last week because of the debates, the presidential debate, but after I watched the debate, I decided we probably should have done a video. But so tonight we're going to talk about the madness. Dr. Dan Murphy is a medical research medical literature researcher, and so he has a lot of great information from the medical journals, and we're going to cover some of that so we can learn about some hazards, some things you need to know. So we'll keep working on this, and we'll get started in 7 minutes. We're about 5 minutes away from start time now, so let everybody know we're going to get started. We're going to be talking about some medical journal articles that talk about some hazardous things that I'd like for you to know about. Maybe it'll save you or your family members and help you be healthier. That's my goal. And we'll talk a little bit about COVID, of course, because that's kind of what's going on. All right? We're going to get started in 4 minutes. Okay, a few more people have gotten on. We're going to get started in 3 minutes. All right, it's about 2 minutes till. It's 6:28. I'm going to go ahead and start introducing what we're talking about tonight. This Dr. Dan Murphy here is a chiropractor that I really enjoy listening to. He's actually a practitioner. He has his own practices in the Bay Area. He actually specializes in car accidents, whiplash injuries. He's also what's the word I want to say, a special witness, an expert witness in medical cases where insurance companies are challenging whiplash injuries, not wanting to pay for them. So he goes in and testifies on the behalf of the people injured. He teaches at a chiropractic school there in the Bay Area. Look at the camera. My sister's coaching me. So he's a chiropractor, but he does lectures, so he researches the literature. So he's not a researcher like a scientist that's in the laboratory doing experiments. He's a researcher of the researchers. So when people are doing the work, the research, he does all the literature researches, and then he reports to chiropractors and doctors what he finds. So a lot of times, us doctors that are in the trenches don't have time to keep up on all the medical journals and what's going on in academia, and so he does that for us. So I like following him. He also has put out some little videos, just little snippets here and there. And so one of the videos that I saw him do was called Madness, and so I thought it was great information. And the way he did it was he was just standing in his office, and he had on a table that he was standing behind a stack of papers, and each one was a copy of a medical journal article. And then he would just share basically the abstract, the Reader's Digest version of that medical article. And it was really, really interesting. And so I wanted to share that with my patients and people that follow me. And so tonight we're going to go over it. I kind of changed it to Stop the Madness, not just madness. What I'll do is we'll just go through, just like he did, we're just going to go through the research and talk briefly about each one of the medical journal articles. And they're included on here. I want to thank my sister Darla she just took the video. I said, will you just watch this video and write down all the references? And then my son Devin helped me make it into a PowerPoint so that you could enjoy it tonight. So let's get started. The first one is just about good old Tylenol. A lot of my patients will ask me, hey doc, what should I take? And I always tell them I'm really not the best guy to ask what should I take, because I don't ever take them. Should I take Tylenol or should I take ibuprofen? So here's just medical research. So this was in the New England Journal of Medicine. Hopefully you can see this down here. Can you see that okay, Darla, there? This was in the New England Journal of Medicine, okay? So right out of Boston, one of the most prestigious medical journals, talking about the regular consumption of good old Tylenol. If you're taking one a day for the year, 365 Tylenol in a year, or if you take 1,000 pills in a lifetime, it doubles the risk of you having kidney disease. So when it says renal disease, that's kidney disease. So Tylenol is really bad for your kidneys. The other thing that I always try to teach my patients is when you take Tylenol, it depletes your glutathione levels. Now, glutathione is an enzyme that's your body's master antioxidant, and it's a hugely important in detoxification, and it takes out free radicals. So really, glutathione is what keeps you young and healthy, and when you take Tylenol, it depletes your glutathione. So Tylenol, double whammy, not good for you, right out of the New England Journal of Medicine. Okay, so that was a good one to start on. That was scary. All right. Here's a study that was done at Harvard Medical School, and as you can see down here, it was published in the New England Journal, or I'm sorry, in the Journal of the American Medical Association. Okay, this study done at Harvard School estimates that the error rate in medicine is so great that it is equivalent to 1.5 jumbo jets crashing every day for a year and killing all on board. So about 180,000 deaths per year. Now, let's put this in perspective. In Vietnam, in 10 years of fighting, we lost somewhere around 55,000 of our troops. 55,000 in 10 years. So this study, printed in the American Medical Association Journal, Journal of American Medical Association, study done at Harvard, says that 180,000 deaths a year, approximately. So that puts it in perspective, that 10 years of war didn't do nearly that. That's pretty interesting statistic, isn't it? All right, here's another one. This was called the Lazarus study. This was also in JAMA. We'll say JAMA, that's the Journal of the American Medical Association. The Lazarus study saw non-error death from taking drugs. This means the right drug, the right dose for the correct problem, correctly diagnosed, will kill on average 106 Americans every year. Makes it the 4th leading cause of death in our country. Non-error drugs, all right? It also results in 2.2 million adverse reactions, and they distinguish that as lifelong disability or a hospital stay. So from taking prescription medications, and this is not the wrong diagnosis, not the wrong medication, but just adverse drug events. We're all not the same petri dish, and so drugs have an adverse effect. All right, that's pretty important to know. Now, this study was done at Stanford Medical School by Dr. Michael Wolff, and he talked about taking non-steroidal anti-inflammatory drugs. We call those NSAIDs for short. For the drugs for pain, it bleeds to death in a typical year 16,500 Americans, specifically counting prescription drugs. So then there's the over-the-counter drugs that are the pain meds that's probably killing closer to 20,000 a year. All right? This was in the New England Journal of Medicine, published study in the New England Journal of Medicine. This makes pain medication the 15th leading cause of death in America. All right? This study was done in the year 2000 by Barbara Stanfield at Johns Hopkins School of Medicine. This is in Baltimore. And it was entitled, Is the U.S. is U.S. health really the best in the world? Here's what her study found. 12,000 deaths a year from unnecessary surgeries. 7,000 deaths a year from medical error, or from medication errors in hospitals. So 12,000 from unnecessary surgeries. Let me just comment on this unnecessary surgeries for a second. I have a patient that is a 35-year surgical nurse. So she has assisted in thousands of surgeries in her career. And one day she came in for an adjustment. She comes in at least once a month because she likes to keep her spine healthy. And I just asked her, I said, just off the cuff, how many of the surgeries do you think that you've assisted in were not necessary? And it was interesting because she didn't hesitate a bit, and she said easily 50% of the surgeries that I assisted in were probably not necessary. Interesting, huh? So, back to the study. The year 2000, Barbara Stanfield, Johns Hopkins School of Medicine. This was printed in the JAMA, Journal of American Medical Association. 12,000 deaths a year from unnecessary surgery. 7,000 deaths a year from medical errors in hospitals. 20,000 deaths a year from other errors in hospitals. 80,000 deaths a year from hospital-acquired infections. So you go to the hospital for condition A. While you're in the hospital, you get condition B, an infection that's deadly. It happens 80,000 times a year in the United States. 106,000 deaths per year from non-air adverse effects of medicine. Remember, we talked about the Lazarus study on a previous slide. So, all those together comes out to be 225 deaths per year caused by the American health system. This was in, again, the Journal of the American Medical Association, published medical journal article. Interesting. So, I want to share, I think I've shared this story before, but I went to a wedding reception, and I was introduced to a neurologist. And I was introduced to the neurologist as Dr. Cathcart. And he shook my hand and said, "What's your specialty, doctor?" And I said, "I'm a chiropractor." And he let go of my hand and he said, "I tell all my patients to avoid chiropractors because you kill people." And so I thought, the gloves are off if he is going to say that. So I just said, "Can I ask you a question?" And he didn't really want to talk to me. I said, "How much do you pay annual premium in your malpractice insurance?" And he didn't want to talk to me, so I said, "That's fine. I'll just tell you that I pay less than $2,000 a year for malpractice insurance, and I'm sure that you pay about 10 times that amount. The medical, or the insurance companies calculate risk." And of course, at this time, he didn't want to talk to me anymore. But the truth is, from what we just studied, 225,000 deaths per year caused by medical error. So all the chiropractors in the United States is about 60,000 chiropractors, over 60,000. In a bad year, there might be one person that dies and it's attributed to a chiropractic accident. Okay? So that means that it would take chiropractors in the United States 225,000 years to do the damage that the medical doctors do in 1 year in this country. So when they say chiropractors kill people, you need to keep that in perspective. What the medical journals, they tell the truth. All right? Here's Johns Hopkins University research. Estimated medical error was the third leading cause of death, and they were citing the study we talked about previously, 251,454 deaths, 9.5% of deaths annually in the United States. So this was printed in the British Medical Journal, in May of 2016. Isn't that interesting? In the British Medical Journal, they were telling on us American doctors. All right? Now, chronic neck and back pain study. This was printed in Spine. So Spine is the leading orthopedic medical journal in the United States. It's just simply called Spine. This was in 2003, a medical journal article. Now this was from a randomized controlled, placebo-controlled, double-blind study. And so that is basically what they call the holy grail of research. This is the ultimate in research, the double-blind study. So group 1 was given non-steroidal anti-inflammatory drugs, NSAIDs, and they found that there was more side effects from the drugs than benefits in this study. Now group 2 was given chiropractic adjustment 2 times a week for 9 weeks. There were 0 side effects, and it was found 5 times more effective than the non-steroidal anti-inflammatory drugs. Okay? A 1-year follow-up from this study proved the long-term benefits of chiropractic adjustments. This was once again printed in Spine 2003.
Karen said that her side effect was 30-minute bloody noses when she was taking pain medication.
So Karen just typed in, sharing that she had the side effect from non-steroidal anti-inflammatory drugs of a bloody nose for 30 minutes. That's rather unpleasant.
So she does doTERRA now.
doTERRA instead of that. A good deal. And she gets adjustments. All right, here's another one. This was in the Journal of Neurology, 2009. Regular consumption of non-steroidal anti-inflammatory drugs increases the risk of Alzheimer's disease by 66%. 66%. So if you're taking non-steroidal anti-inflammatory drugs on a regular basis, you're increasing the chances of you getting Alzheimer's significantly. This is from the Journal of Neurology. They might know a little bit about Alzheimer's, right? Here's another one, interesting. Regular consumption of anticholinergic drugs, and don't worry, we're going to talk about that, depending on the other variables, increases the risk of Alzheimer's disease from 150% to 700%. All right, so now let's talk briefly about what is an anticholinergic drug. It's a broad range of drugs, okay? So it's basically inhibiting the physiological action of acetylcholine. So acetylcholine, when your nerve synapses, your nerves are talking, and the communication, it uses acetylcholine. So basically what these drugs do is affect the physiology of the nervous system by blocking acetylcholine, okay? So what kinds of drugs are we talking about now? So I'm going to come right over here because there's a list of drugs here. So some of you that are on these medications, please take note. So anticholinergic drugs include antipsychotic medications, okay? Anti-bladder, okay, to help your bladder not leak, I guess. Anti-nausea drugs, bronchodilators, muscle relaxers, antihistamines, all right, brand names like Benadryl, and antidepressants like Paxil, okay? That's a whole lot of different medications. So regular use of these anticholinergic drugs also increases the risk of Alzheimer's. Is it any wonder that Alzheimer's is at an all-time high in this country? So many things are contributing to this. By the way, this was in JAMA 2016 Medical Journal, the Journal of the American Medical Association. All right, here's another one. The harm outweighs the benefits of U.S. medical health care. This, again, in JAMA 2009, the author stated, although there is no doubt that many health services are effective, it is possible that the net health harm caused by medical health care may be greater than the benefits. He discussed the fact that, yeah, if we just stopped all medical care right now, there probably would be some people that would be harmed by that. But the net effect would be positive because of all the things we've talked about tonight so far. All right? Now, Dr. David Clausen reported the adverse events, medical error, occurred in 1/3 of hospital admissions. So, out of 100 people, 33 of them are going to have an adverse event in the hospital. Now, Dr. Jill Vanderhaas said that the cost of these adverse events that Dr. David Clausen was talking about is $17 billion a year from the hospital. All right? This was in the Journal of Health Affairs 2011, another medical journal, peer-reviewed medical journal. Now, codeine, time to say no. Codeine is harmful yet commonly prescribed to children. This was in the Journal of Pediatrics 2016. Tylenol with codeine, cough suppressants with codeine. Codeine is harmful to children. Should not be used if at all can be avoided. No codeine. Just say no. Here's another one. This was in the journal called Pain Therapy. This was in 2018. Study done at Harvard Medical School by Dr. Mark Jones. He stated that opioids are killing 64,000 Americans per year. Opioids, such a problem. I also read a study that said they estimated that 80% of the heroin addicts on the streets started with a prescription of an opioid from a medical doctor, and then when they could no longer get the prescription, they were able to buy the heroin on the streets cheap and keep their addiction alive. Huge problem, huge problem. Researching non-drug approaches to pain management. This is interesting. The author stated pharmacology for pain has been, pharmacology I should say, for pain has been a disaster. That was from the author of this study that was printed once again in JAMA, the Journal of American Medical Association, in 2018. Pharmacology for pain is a disaster. The study found that chiropractic care has the best evidence for managing pain. It's interesting that they would admit that in the Journal of American Medical Association, but they did 2 years ago. All right, this study, I like this, just study after study. This study was done at Yale Medical School. Found that getting chiropractic involved in pain management reduces the use of opioids by 66%. So if somebody has chronic pain and they're getting chiropractic care, they're going to need 66% less medical intervention. Isn't that nice? This was in the Journal of Pain Medicine, December 2019. Very recent, very recent. All right, this paper found the effects of taking aspirin to prevent heart attacks is ineffective and causes substantial harm. This was in the New England Journal of Medicine, 2018. There's been other studies done. I remember years ago reading a study that a lot of times people tell me they're taking an aspirin every day to help prevent heart attacks and strokes. Here's a study done in 2018 said it's just not true. It causes more problems than it helps. This study at UCLA Medical School found that a daily dose of aspirin to prevent stroke actually significantly increases the risk of stroke, taking an aspirin every day. Journal of the American Medical Association, once again, this was just May of last year. Very current study. All right, now statin pharmacology. If you don't know what statins is, statins are cholesterol medications, and we've been lied to for 50 years about cholesterol. Everybody's been taught that cholesterol is the bad guy. It's just simply not true. But here's interesting, the statin pharmacology, they called it the ugly side to statins. This was in the Journal of Endocrinology in 2015, medical peer-reviewed journal. This study found that statins do not prevent heart attacks. They actually increase the risk of heart attacks. Statin use also increases chances of Parkinson's, cancer, cataracts, and arterial calcification. They have a little picture here of some calcification in the artery. Very interesting study. There's a lot of controversy surrounding statin medications. One of the other things that statins do, very similar to what we talked about earlier about Tylenol, is statins also depletes your glutathione levels, and glutathione is very important in keeping you young and detoxified. You don't want to do that. All right, I believe that's all our slides. Yes, it is. All right. So, I really appreciate you tuning in tonight. I loved this little lecture by Dr. Dan Murphy because it may be a little controversial, but everything we said tonight is in medical journals, peer-reviewed medical journals. Darla, were there any questions tonight that anybody needed answered?
Karen was just sharing different doTERRA products that she uses for her pain relief.
Oh, okay. The blue...
Copaiba, which is the one that has like CBD
Yeah.
in it.
CBD is a very good natural pain reliever.
And then dual chamber turmeric. Turmeric
is a very good herb. It's a natural anti-inflammatory. CBD is natural
And then we have our
anti-inflammatory.
LifeWave.
LifeWave patches, very effective, natural anti-inflammatory, no drugs. We also have bromelain. Bromelain is an enzyme found in pineapples that's actually a very good natural anti-inflammatory. A lot of times people, like fibromyalgia people that are chronic pain, when we examine their diet, we find out that they're eating a very inflammatory diet. Many people are very sensitive to sugar. Sugar is a very inflammatory food. Sugar increases your chances of cancer. Sugar increases your chances of heart attacks and strokes. Sugar's bad. Sugar, bad.
And Karen did say that CBD is not in Copaiba oil, just to correct me.
Oh, I don't even think I said that, so.
I did.
So there's a lot of things you can do if you have chronic pain. If you're not getting regular chiropractic adjustments, you really are missing the boat. We've talked so much since March about how important it is to get your adjustments, how it helps immune system. I got censored for saying that chiropractic care enhances immune function. I have 14 studies in there on my desk that says I'm right, peer-reviewed medical journal articles that says chiropractic adjustments, it's been proven that it enhances immune function. Just the history of the 1917, 1918 flu epidemic, that those people that were receiving chiropractic care did infinitely better at fighting off the flu. It hasn't changed. If you're worried about the flu season this year, and of course the ads are already starting to say you need to get your flu shot. We have a little poster on our board in there that says the flu season is not a season. The flu season is not a season. The flu season, what they really should call it, is vitamin D deficiency, increased sugar intake, and increased stress. That's what the flu season really is. So during the flu season, that's not really a season, you need to increase your vitamin D intake. Vitamin D is from the sun, and when the sun is not out as much, and we're wearing sweaters, we're not getting as much sun, we're not getting out, so you need a supplement with vitamin D. Vitamin D is very important in immune function. It's been proven, there's no debating it. I mean, you can try to debate it, but I'll beat you in that debate. But vitamin D, very important. Stress, the holidays is always increased stress. With what we're going through with this pandemic, it's increased stress. One of the most important things to do when you're stressed is exercise. Also getting adjustments, very good to help your body handle the stress so it doesn't eat you alive. But exercise is very effective. And then sugar consumption during the holidays, it starts with Halloween. We're eating more sugar. And then into the holidays, all the pumpkin pie and the apple pie and the cherry cream pie and all the sugar we eat for Thanksgiving, and then we get right into everybody sharing the baked goods for Christmas. And so we're just consuming so much more sugar right into the New Year's, and all that sugar suppresses immune function, and so they call it the flu season, but it's vitamin D deficiency, increased stress, increased sugar consumption season. And knock it off. Take care of yourself. Please don't do this. So thank you very much for joining us tonight. It was nice to cover scientific journals. There's not much room for debate. Please take better care of yourself. See a chiropractor. Thanks for joining us tonight.